Hey everybody, how you guys doing? This is Dr. Janae Brown with Physical Therapy San Pedro. I actually am sitting on my couch in my house, so I'm resting and relaxing, but it's been a while since I've been able to come and do some video and say hello to you guys and um, talk about some things that I've had questions about. So today I'm going to talk a little bit about the difference between physical therapy, chiropractic care, acupuncture, yoga, Pilates, exercise, strength training, all that stuff. So I had a question about that quite a while ago and just wanted to address that with you guys. So, of course, I'm a physical therapist, so I'm biased, and I think that physical therapy is a great resolution to heal, any injury in the body, physical injury in the body. Um, and physical therapy is all encompassing. There are physical therapists that do things differently. So some do just soft tissue work and they work on the muscles and do mobilization of the muscle and the soft tissue. There are some that are very exercise focused and do solely exercise with their patients and do a lot of strength training, resistance training. Some do just Pilates or yoga. So you have a gamut of variety. I, do manual therapy, so soft tissue work, joint mobilization. I try to address what is maybe a source of a problem in terms of how the body's physically responding to whatever the issue is by doing some hands-on. I feel like everybody needs to be touched too. I mean, when you're hurting and there's something wrong or there's a problem, your body's telling you by responding in such a way that needs maybe some hands-on love. So I do that first. I always start most of my treatments, if it's needed, with some hands-on stretching or soft tissue work or joint mobilization, muscle energy techniques, whatever is needed hands-on. And then I usually move into an exercise program that is developed to address whatever the problem is, either improving mobility, improving stability, strength, maybe improving mechanics, body mechanics, or the way the patient's moving, not moving correctly. So they're getting injured because they're not doing things correctly in sport or they're not doing things correctly in their daily life. And so that's the way I approach my treatment. And usually I end my treatments with a modality if needed. If there's pain still remaining after, cold pack is usually my form of choice. It's the best natural modality to address swelling and pain. I'm not a big fan of much of the other ones, but that's not to say that they don't work. It's not something that I've seen a value for me in the many years that I've been practicing. So I've been practicing as a physical therapist for 13 years, and I've seen and treated a lot of different conditions in my time, both orthopedic, sports, neurologic, brain injury, stroke, that stuff too. So seen a lot of different things, and I've used a lot of that stuff in all encompassing in the way I practice. So that's a little bit about physical therapy. I work side by side right now with a chiropractor. He's amazing. He's awesome, and I think there's a great value in chiropractic care. The same thing as with physical therapists, chiropractors are all very different. Some just do adjustments and they just are looking at spinal correction and alignment. And there's others that do soft tissue work as well. There's others that make exercise a part of their program. I feel like chiropractors and physical therapists are kind of coming to sort of a medium as time goes on. Physical therapists are learning a lot more about osteopathic medicine, manipulation, and we're learning how to do that, be effective with, sort of what you would call an adjustment. And then there's, chiropractors who are learning a lot more about exercise and prescribing exercise, or maybe hiring on people who they can have do exercise with their patients in their clinic. So definitely great value. Spinal alignment, alignment is huge, and you can get to normal alignment in a lot of different ways. You can get normal alignment through manual therapy, and you can get it also through exercise. So the way, there's a lot of paths, to the same, you know, road or journey or whatever you want to call it, So, um, and those acupuncture is actually something that is new to me. I've had acupuncture myself. It's worked. I believe that there's value in acupuncture as well. With acupuncture, the goal is, I'm not expert at acupuncture, but I know that the goal is, it's based on the meridians, and the goal is to really, get rid of the pain. Ultimately, it's focused on getting rid of the pain, wherever it is along the pathway that could be, creating a problem. So, I think that there's value in acupuncture as well. I think at the end of the day, though, you need to get to the source of the issue. So, if there's pain in the body and you get rid of the pain, you need to figure out why you've been having the pain, and that's really the key, I think, to not having pain return, is what is the reason why you start having it. So getting rid of it's one thing, and then really resolving what the issue is: strength, stability, mobility. And that's where I think exercise, and being able to have somebody study your movement and analyze, how you, when and how you got injured, and make sure that you don't re-injure whatever way it was. Whether it was that you start having, whether you have poor posture and you're sitting at your desk incorrectly and your desk setup's not right, whether it's you're a basketball player and you keep cutting wrong and your knees turning in and you keep spraining your your MCL ligament, or you get repeat ankle sprains as a soccer player because you have some hip weakness or poor mechanics. So there's a lot of different, you got to find the source of the issue so you can retrain the person to not keep having the problem. And so if you just cover the pain and get rid of the pain, that's sort of like what pain medication does. It covers the pain, or it stops the pain for a period of time. That's temporary. It's very likely that your issue is going to return. So those are like the alternative treatments. That's what I know about chiropractic care, acupuncture, a little bit about physical therapy. At the end of the day, my goal with all my patients is to get them into a maintenance program. And really what I try to do with most of my patients is find out what exactly it is that they enjoy doing. And everybody's different. Some people never exercise, and if you never exercise and you need to maintain, maybe you have a back injury and you need to have some maintenance, and so you don't have it return, we need to figure out how to do that. So if you've never exercised before, a lot of those patients, I give home exercise programs, and I tell them, they need to really stay on doing exercises. If they enjoy things like yoga, Pilates, strength training, maybe they have a gym membership, maybe they need one-on-one training with a personal trainer. I've tried to, for myself, key into the people in my local community that do things in all those areas so that I can refer patients to those people, once they're discharging. So the goal is get my patient pain-free, strong, and then get them to a place where they're going to have maintenance and not have the problem return again. Otherwise, very likely they're going to end right back up in my clinic, on my table, and doing more physical therapy. So I want to help my patients have, a resolve, long term. So I think yoga is really great for flexibility and mobility and core strength. Same thing with Pilates. Pilates is different because Pilates isn't focused on stretching as much, but a lot on core strength, a lot on posture and alignment, which I think is something huge and needed right now with the postures that we all assume on a daily basis that are not good for us. Even lying in bed and on our devices, constantly having our heads forward and our bodies just being weighted and pulled into what we call anterior position and forward position. So I love Pilates. I'm Pilates certified, and I use Pilates a lot in my treatment protocol. And I do incorporate yoga as well. What I've learned of taking yoga, and I think it's awesome as well. And strength training is a huge part of most physical therapy programs. Most physical therapists know enough about strength training to rehab their patients. So I think, that is great as well. Kickboxing is awesome. I did a challenge earlier this year and had not done a ton of kickboxing before that time. And I think that kickboxing is a great way also to strengthen, upper body and lower body and stay strong and stay fit. So, but yeah, I think the biggest problem, at the end of the day, and I'll end on this note, is that, people get stuck in doing the same thing over and over again. And I challenge you to try different things. Part of what I do in the way I work out to take care of myself is I don't just stick to one thing. So I do some strength training, I do Pilates, I do yoga, I take classes, I alternate my fitness program, and that's just to keep my muscles healthy. Repetition of anything can create injury. And so it's a huge thing. If you're an athlete and you're like a swimmer or you're a soccer player, if you're going to a gym that just does kickboxing every day, or strength training every day, you're really likely to get injured because you're just doing the same things over and over again, and you're not letting your body change up what it needs to do. It needs to be strong, but it needs to be flexible and mobile. So changing up your workouts and doing different things is a great way to keep you from getting injured. So I hope that answered some questions about the differences and some of the alternative treatments that you can get for injury, and then, sort of how you maintain, post injury. If you have any questions, you can drop a comment below. You can like and follow me on Facebook and Instagram and Twitter at Physical Therapy San Pedro. And this is Dr. Janae Brown, physical therapist in San Pedro, signing off. Have a great day. Bye.